Coming, if you'd like to come up, please, Mr. Mackie. Thank you. Welcome, and just to confirm that you've received the letter for a person presenting to the committee.
Yes, I did.
Thank you, and the clerk will swear the oath.
Mr. Mackie, did you want to swear an oath or be affirmed?
Swear an oath.
So the Bible's in front of you there. If you could just put your hand on the Bible. Thank you. Mr. Mackie, do you solemnly swear that the evidence you shall give to this committee touching the subject of the present inquiry is for the truth, the whole truth, and nothing but the truth, so help you God?
I do.
Thank you.
Thank you. And you may make an opening statement up to 10 minutes, and then we'll go to questions. Thank you.
Okay. Thank you. First, as you are aware, I previously made presentation to this committee as a director of the Ontario Air Transport Association back on April the 18th of last year. Excuse me. Today, I am here as the president of Thunder Airlines Limited. As a refresher, if you will, I have been involved with the air ambulance system here in Ontario since 1978. I've had the opportunity to witness firsthand the development and growth of the provincial air ambulance system. I personally have in excess of 10,000 hours of flying air ambulance flights alone. I have had the privilege of sitting on aviation safety boards, as well as various Ministry of Health committees that were formed as a direct result of the Air Ambulance Review of 1993. In fact, it was while on one of these committees that I first met Dr. Chris Mazza. Over the years, Thunder has provided extensive primary and advanced care air ambulance service. We have transported in excess of 35,000 patients. In fact, 2 of these patients were born on board our aircraft in the air over Northern Ontario and delivered by Thunder's own flight paramedics. Thunder is a mature and stable company with a senior management team with many years of aviation experience in Ontario. Thunder Airlines itself commenced operations in 1994. We currently employ approximately 100 people at our bases in Thunder Bay and Timmins, as well as customer service agents up the James Bay coast. In addition to providing air ambulance service to Orange and the people of Ontario, we also operate a daily scheduled air service from Timmins north to Moosonee, Fort Albany, Kashechewan, Attawapiskat, and Peawanik. And in addition to an active charter service in support of our northern communities and businesses, we also have multi-year contracts with both the provincial and federal governments, as well as private industry, to supply dedicated air charter service. I guess what I'm saying here is Thunder Airlines is a financially secure company with plenty of aviation experience in this province. We currently fly in excess of 10,000 hours per year. We wholly own our aircraft, our hangars, and our equipment. And we sure don't owe anybody $270 million. When the government announced the formation of what is now Orange in 2005, we saw it as a positive step forward. A centralized base hospital, a mandate to train medics, operation of a dispatch center, and a mandate to manage the actual flying contracts with the various air carriers. As Ron Sapsford said before this committee in February of 2006, and I quote, essentially the corporation, now Orange, is renting the aircraft, if you want to put it that way, but taking care of the patients, doing the dispatch, and managing the actual process of transport is being done by the corporation. He went on to say that the Ministry of Health isn't in the business of flying helicopters, maintaining them, and so forth. It is a specialized business that others can provide on a contractual basis, I would argue more effectively and more efficiently than we could ourselves. On August the 1st, last year, Mr. Sapsford, before this committee, acknowledged that it had never been contemplated that Orange would operate their own aircraft. He also acknowledged there really wasn't anything to stop them from doing so, however. The point is this. There was never any intent by the government for Orange to operate their own aircraft. Okay, this we know. It was acknowledged by the government that the air carriers that could provide this service more effectively and more efficiently So what has changed? The reality is Orange and Orange Air operate in the same manner as any other government agency, so I would question where are the efficiencies. It is my opinion that Orange should be put the focus back on the original mandate, a mandate that did not include being an air carrier. I'm currently asked on occasion, how is it dealing with Orange now that the changes have been implemented, and there have been changes? The answer is a complicated one. As an SA carrier, we do see some change and improvement, but as an SA carrier, communication with Orange is fairly limited. And it's usually limited when there's some sort of problem that needs to be resolved. That said, I will say that there are improvements. The communication with senior management is open and frank when it needs to be, although it does at times seem that some of the managers can be frustrated from what appears to be a bureaucratic formalities that many are not used to dealing with. Some have just recently left Orange because of this. However, there's still work to do. From my perspective as an SA carrier, there are issues with conflicts of interest and a lack of auditing enforcement of contractual obligations. As I mentioned, I'll keep it short because I said pretty much everything I had to say the last time I was here. I thank you for the opportunity to appear today and welcome any questions.
Well, we'll go to the opposition first. Mr. Please.
Thank you, Chair. Mr. Mackie, thank you for being here, and we want to acknowledge your expertise and your experience in the aviation business, and this committee values your advice and your insight. As you know, these hearings have been going on since March of 2012 in response to the Auditor General's report on Orange and the various issues that Orange faced. The key findings in the report by the Auditor General was that the Ministry of Health failed in its oversight responsibilities. And that in turn led to many other issues. And the Auditor General made 5 key recommendations. Every one of those recommendations focused on this issue of the need for increased oversight and accountability. And I'd like to, in my questions with you, focus on that, because what we need to do is get a sense of what progress we're making on that oversight issue and what still perhaps remains to be dealt with. You're one of 5 aviation companies that contract services to Orange. Is that correct?
I believe that's correct, yes.
In front of you and all the members have a document entitled Request for Proposals. And it's RFP number 000-10347. You're familiar with that document, obviously. Am I correct in saying that document was, in fact, the last RFP, the most recent RFP issued by Orange?
For standing agreement services, yes.
Yes. That document is a very comprehensive document setting out the obligations and standards for the operations side of the business. It sets out very specific contractual obligations that you and the other carriers have in terms of delivering their services. Have you ever been audited by Orange for compliance with that contract?
Not recently, no.
When was the last time that you were audited by Orange for the delivery of the services under that contract?
I would honestly have to go back a few years, perhaps as many as 4 or 5. Don't mistake me. They do come in if there's a change, if we add a new aircraft to the system, or if we add a base, they do come in and inspect on that occasion. But whereas Orange used to, years ago, we would get visits a couple of times a year for them coming in and checking to make sure we were following our obligations. That just kind of stopped.
Mr. Horvath testified last week at this hearing as well that he has not had an on-site audit by Orange either, that when the contract was initially issued to him, there was a site visit but has not heard from Orange since then. That concerned me as I heard that, because when I review the RFP, there are numerous requirements there that if you don't have an on-site inspection, whether that's of the facilities, the equipment, the instrumentation for the aircraft themselves, how is Orange to know whether or not someone is complying with the terms of that contract? Would you agree that, given the instructions of the Auditor General or the recommendations, that what is needed is more oversight? What I'm hearing from you is that there has actually been less oversight on this particular aspect of operations than in previous years.
Yes, that is, and we welcome being audited in all manners. We're audited all the time, including by an Orange contract organization, Argus. As far as with respect to our operations. Now, I mean by operations means, generally speaking, adherence to the Canadian aviation regulations.
I understand that Argus does this as a third party. They offer an upgraded accreditation. Mr. Horvath was here last week, told us that he takes great pride in the fact that he has a platinum rating from Argus. I understand that in order to get that, you actually have to pay Argus a fairly substantial fee that ranges anywhere from $8,000 a year. I think Mr. Horvath may have gotten a deal on it. But can you confirm for me that this third-party auditing firm is really a business that seems to market itself to the very people that they're charged with auditing?
Well, back on, I actually happen to have it here, back in July of 2012, we had an Argus audit that was forthcoming on behalf of Orange, and I received an email from Argus sales manager essentially pitching, our guys are going to be there. If you want to spend some extra money, they'll be there for an extra day, and we can give you this platinum rating. There was a fee to go along with that, along with we would have to pay them $150 a month for every month that we wanted to maintain that rating. I found that a gross conflict of interest right then and there, and I took that email and I forwarded it directly to Ron McCurley. I never heard back. However, I never got another email either. So whether it got actioned or not, I'm not quite sure. I did talk with Ted Rabicki about it, and then I thought it was essentially indecent that this would even happen. I have somebody coming in to audit my organization, and hey, you slipped me $5,000 or whatever the amount was, and we'll give you a platinum rating. Well, no, I'll stand on my own scruples. Thank you very much.
So I'm assuming you don't have a platinum rating.
No, I do not.
But this is the organization that Orange relies on to do its third-party audit of the operations side.
Yes, I can't. Sorry, I have an Argus audit at 9 o'clock tomorrow morning from Orange. But I hope they're not watching right now. But no, actually, the people coming from Argus are professional. And they are, the first time that they came in, it is an American company. So it is people with an aviation background, obviously, but when they first came in, they were more familiar with the U.S. regulations vis-a-vis the Canadian regulations, and there are differences, some substantial differences. I think they're through that learning curve now. We get Argus coming in, for example, tomorrow will be my third operations audit by Argus alone, and there have been others, just in the last 12 months, because we're also audited by various clients, private clients as well.
But those audits, and here's the heart of what I'm trying to get to. Those audits are typically aviation operations audits. Mm-hmm. Those audits do not deal with issues such as the front line delivery of air ambulance services in terms of the supplies that you have to have on hand, the very specific contractual obligations that you have under the terms of your agreement with Orange for the service delivery. Is that correct?
That is correct.
Okay. When Mr. Horvath was here last week, we heard some very disturbing testimony about what he referred to as conflicts of interest. He referred specifically to the fact that a full-time employee of Orange was actually assisting with the writing of an RFP for a competitor. And he made reference to other conflicts of interest. You make reference to conflicts of interest in your opening statement. I have heard that there are some concerns about that inherent conflict of interest at the dispatch center. Could I ask you to elaborate for the committee in terms of what precisely we're talking about, give us an example of that, and what you feel needs to be done to eliminate that conflict of interest?
First of all, there's been conflicts in the dispatch center going back actually long before Orange, to be honest with you. However, the current situation, early this past spring, we have our own dispatch department, obviously, and our dispatchers work with Orange dispatchers when planning flights planning flights in general. Last spring, my dispatchers started to question one particular dispatcher at Orange and as to the dispatch practices and his mannerisms with them, with our people. And generally, it was, well, if you don't do this, I'm going to take a flight away from you, and so on. In fact, understand is that the dispatchers really hold a lot of power. They're the ones that decide whether or not your aircraft are going to fly. In other words, they make whether you're going to be in business or not, quite frankly. So I advise my customer service head supervisor for her to have her people document, what they could, what was going on, and say, just remember, that's customer service. Orange is a client. Deal with it. Work with it the best you can. We didn't make any complaints until a paramedic that works for me came into my office and said, did you know that this particular individual is also a paramedic flying for Bravo? So, no, I wasn't too happy about that, obviously. So I picked up the phone within minutes, and I spoke with Ted Rubicki, who I believe you know is no longer there. But he was our point of contact. And I talked with Ted, and I go, Ted, we've got a problem in dispatch, and, I think there's a conflict of interest. And his answer to me was something along the line, oh, you mean Travis? And he said, no, you're the second carrier that has complained about this. And he assured me at the time that they were going to deal with it, that they would not be allowing people to, work for the competition at the same time. It's an obvious conflict, right? So anyway, I took that at face value and didn't hear too much anymore. I became aware over the summer that Travis was still employed in the dispatch center, and I was kind of wondering, but to this day I don't know if he's still working at Bravo. I can't speak to that. I don't know. But in August, our flying, the first part of the month was somewhat dismal, and flying does fluctuate, but I mean, we keep statistics. And we watch the competition, and knowing where we were on the competitive bid, that something was amiss. So I called Ted Rubicki about it. Middle of August, say around the 15th, and Ted said he would look into it. I didn't hear back from Ted. But subsequently, we did talk to him about this on his last day of employment there. But it was within about 48 hours of that phone call that our flying went back to normal. And when I spoke to Ted, on his last day, because I only found out as he was basically as he was going out the door that he was leaving, so I gave him a call. And anyway, he said, "Oh, by the way, did your flying pick up in the middle of August?" I said, "Yes, it did." And he said, "Okay." Well, he said, "I went downstairs and somebody was messing with the algorithm." And the algorithm is used to pick the air carrier, which one is the most appropriate, and ultimately, as well, takes all the cost parameters into the situation. So he said, yeah, somebody was messing with the algorithm. And they said they weren't. We took it up to our people. We ran the algorithm to double check it. The algorithm worked fine. And he was telling me that just in about the same tone that I'm using. So we went back down. We had a little chat with the individual. And I go, "Oh." I said, "I don't suppose that first name starts with a T." And Ted's answer to me was simply bingo. So that was Ted's last day. Then last week, flying started dropping off again. So I no longer have a good contact at Orange, so I called at that level. So I called Rob Jagir, who was away. I spoke with his assistant, who was excellent, by the way. And she took the information, and probably within 30 minutes, Mr. McCallum called me himself. And he was on it, very open and frank, and was looking at it, and he said, "Bob, I will get back to you by the end of the day today." And it was after 5 o'clock in the evening. He did call me back to say that they were still looking into it and they wanted to do some more auditing. He had been told by his people that they didn't really think there was anything wrong. I told them I thought otherwise. You know, if it stinks, it stinks. You know, and what brought this last one up over this last weekend is I've got aircraft and 3 crews, paramedics and everything sitting on the ground in Thunder Bay, while the other company, which I'd been told, were first out because we were the lowest bid. We sat on the ground and they flew all over the province. You know.
Well, Mr. Mackie, thank you for that, and I'm sure that the folks at Orange are watching this very intently, and I would expect that this issue will be addressed.
Yeah. I would, you know, as Mr. McCallum did point out, he's not done with this yet. He's still working on it, and he was talking about getting a third party to take a look at the algorithm.
How much time do I have left?
4 minutes.
Sorry for being long-winded.
No, look, it's important. I mean, look, something as significant as this and a very gross conflict, what quite frankly is frustrating to me and must be to anyone observing these hearings, is that something as blatant as someone who is employed by a competitor, that individual would also be hired into a dispatch position, clearly who has absolute control over your business, is unconscionable. And so this is a strong message to the management. Someone at that management level, obviously, is responsible for this, and we can't have that happen. So thank you for your forthrightness, and we would expect that it would be dealt with. In the RFP that you have in front of you, page 63, the last paragraph states this: Orange reserves the right to inspect bases from time to time. Orange expects to visit a minimum 2 times per year to ensure compliance with policies and procedures for equipment, supplies, for cleanliness of the base. You've testified here that over the last number of years you haven't heard from Orange once. I would expect as well that Mr. McCallum would be focused on this. Quite frankly, I heard of an incident just this week that disturbs me greatly, that I believe reflects again on the lack of oversight. When Mr. Horvath was here, he confirmed that in this RFP there is no reference to any requirement for a proponent to prove financial capability of delivering on the contractual obligations. And yet I did some research. 3 RFPs ago, there was an entire schedule, Schedule A, that required financial information, financial statements that gave the authority to Orange to do a credit check. You are in other businesses. These are not the only contracts that you have. As a business person, when you realized that for the last 2 RFPs there was no requirement for a proponent to prove their financial capacity, did that strike you as somewhat odd?
Well, it struck me as odd, but to be honest with you, I thought, oh, wow, that'll save us some time. I don't have to do that part of it, just from a selfish point of view. But no, I mean, we bid RFPs all the time for other government agencies and private clients, and we do need to show that we're a financially stable company. So, yes, it was quite odd that we thought that it had been left out.
It's a highly competitive bidding process, isn't it?
Yes, very.
Mr. Horvath testified that after the closing of the bids, he received a call from Orange suggesting to him that if he wanted or expects to get the guarantees that he would need, that he would have to reduce his numbers. And so we can see that the grinding down of these numbers is taking place. Do you get calls like that as well after submitting a bid?
Well, after we submit the bid, I mean, I guess we have to remember, this isn't a tender. This isn't a request for proposal.
Right.
And in the proposal, after that, then you sit down and you negotiate. And one of the points that you do negotiate, and I'm not just talking about this RFP, you negotiate price. I just finished negotiating pricing with Canada Post after my RFP went in. So that's normal. But as a matter of fact, I think it's on page 8 or paragraph 8.2 in here, it actually says in the RFP that they reserve the right to try to negotiate pricing. It's in here.
It does say that, and here's my point. When it gets down to the point where essentially, depending on the carrier, you start to buy the business, there are some fixed costs in the industry. Mm-hmm. Where do you start to cut back when it gets to the point where you're actually now bidding below your capacity of being able to properly maintain? You can't cut back on fuel. You can't cut back on salaries. Where then, what's the last point at which you start to compromise and cut back?
Well, there can be a couple of different scenarios there, to be honest with you. If you cut back on wages, you don't have staff. You have to be competitive to have your staff. If you're paying for your airplanes still with the bank or whether you're leasing them, they're not going to cut back. If you're going to cut back on your profit margin, that'd be about the only place. Otherwise, you're going to look for any little way where you can squeeze a dollar.
How about maintenance?
Sorry, you're out of time, Mr. Cleese. We'll move on, and if there's any left again, come back to your maintenance question. Ms. Gelinas?
Thank you for coming back to see us, Mr. Mackie. And I was there when you came last time, and you talked to us about some of the bases, mainly in Northern Ontario, that had closed. That was at a time where Mr. Mazza had just left. Since then, we were told that things have improved. I want to get your take on it as to the number of bases and the level of service for the people of Northern Ontario.
Well, I'm just quickly going through, because what you're alluding to there is I cannot think of any base that's been added since I was here the last time. That's not absolute, but there's still, I'll talk fixed wing here. Yes, since the last time, pardon me, I guess I should have known this one, I put an airplane in Timmins to go with my other 6 aircraft that I have based in Timmins that do other work. So that would be about the only increase in bases that I could think of. And of course, Orange has a fixed wing base there as well. Again, it's people have been driven out of business since Orange Air started, since Orange started, period. You know, the bases that you don't have, they've disappeared and they're gone. And I would suggest forever is a long time, but I don't hear anybody making noises about coming back.
Could you talk to me about the type of cases you are getting now versus what you were getting? Has it changed? Has it evolved? Is it stayed the same?
Well,
Not volume as much as type.
Well, as I mentioned in my opening statement, we used to be an advanced care carrier as well as primary care. Today, we're strictly primary care. We got out of the advanced care. We were the largest advanced care provider in the province. We actually had aircraft dedicated, pilots, paramedics, aircraft ready to go, airborne in less than 10 minutes that mirrored the critical care operation out of Dryden. Plus we had that in Timmins on a smaller basis and out of Thunder Bay. But when interfacility transfers in the advanced care was suddenly axed in 2006, we just said, okay, that's it, and we got out of the advanced care business. So we're strictly primary care now. That said and done, we still move, on occasion, advanced and critical care patients when suitable escorts are brought along, whether that's the sending hospital, sending a nurse, a doctor, or whatever. And that's not uncommon. But most of the stuff that we do is primary care now.
So it would be mainly interfacility transfer?
That's right.
From Northern Ontario to Sutton. Do you do it in reverse? Do you bring people back?
Yes, we do.
You do. You do it both ways. And so since you have, in 2006, so that's quite a while ago, you made that decision to go strictly primary care.
That's right.
Okay. And that decision was based on the fact that there was not enough of a volume of...
We probably had to lay off 20 paramedics with the result of that decision that was made by Orange. That decision, by the way, was never, ever communicated to us. The phone just stopped ringing. And of course, with associated, did we lay off pilots at the time? I believe we laid off a few, but we were able to absorb them into the rest of the organization. The medics, though, they work. Most of them work for Orange today.
You work in the business. Mm-hmm. You see the patients on the ground. How would you say that the North is being served right now?
It has evolved. There's probably some, I would suggest, and I don't have statistics, but I would suggest just from my own observations that people are going to be waiting a little bit longer to get transferred in an emergency situation because you don't have quite the same amount of coverage. But it is... Orange has a critical care fixed wing base out of Sioux Lookout, and they also have fixed wing aircraft out of Thunder Bay. Thunder Bay is I think probably one of the busiest, if not the busiest hub for ambulance work in the province. Mm-hmm. Mind you, going from Thunder Bay, if you're trying to get up to Big Trout Lake, Bearskin Lake, or whatever, you really should be leaving from Sioux Lookout. They have Orange has a large fixed wing base in Thunder Bay. I question that that's the best place to be for them, but I do know that they do have, and always, and Ministry of Health had the same problems with getting people to stay in Sioux Lookout, so that may be part of their problem.
You mentioned that people might have to wait a little longer in emergency situations. What basis do you have to say that?
Well, just the flying time.
What objective criteria do you have to say that, or are you just speculating?
Well, I'm speculating to a certain amount, but I mean, if you have an aircraft, if you got an Orange PC-12 depart Thunder Bay to go pick up in Big Trout Lake, and you have one leave at the same time that was available in Sioux Lookout, the one that left Sioux Lookout will be well on their way back with that patient before the first one, before the Thunder Bay machine even gets there. It's just distances. It's huge distances. People don't understand how big Northern Ontario is. That's the thing. I did a presentation to an aviation seminar a while back, and it was actually down in Texas. So they think Texas is big. Well, I took Texas and I stuck it in the middle of Northern Ontario, and I opened up some eyes. So yeah, just distances.
Continuing on, does a specific case come to mind or a story come to mind?
Nothing particular, no.
Okay. So your contract with Orange is for primary care.
Yes.
But every now and again you will be dispatched to a call that is advanced care. How does that happen?
Well, we're still primary care. My primary care medic is on board to lend a hand if need be, but the people that are looking after the patient are actually coming with the patient. So my medic is more or less sitting in the back, not idly, mind you, but we'll sit there because familiar with the aircraft, where the equipment is, and so on. So, and this is the way it's always been. It's like going back, since I ever started. If the doctor needed to come along, and I've seen a few things over the years, they do what they have to do.
Okay. And then do you know what happened to this doc or this nurse once they're in Thunder Bay, but they work out of?
They're usually flown back. Yeah, I mean, quite often we'll sit there and we'll return the doctor or nurse back to the facility. There are occasions, nothing recent, I might add, though, but where Orange has, it was a few years ago, where Orange announced we're not going to return nurses back to these nursing stations or back to these remote hospitals, and the ministry tried the same thing a few years ago. The problem with that is that some of these hospitals and in the further out regions, they're short-staffed. And, if a nurse leaves the floor to fly on an airplane to Thunder Bay, they need her back on the floor. Well, for a while it went, well, take a taxi back to Marathon or whatever. Well, I could fly her back in 30 minutes versus a 3.5-hour taxi ride. So pretty soon the volunteer from the hands company, who wants to take this air ambulance flight to Thunder Bay? There's no volunteers to go. So the pendulum has gone back and forth more than once that I've seen over the years.
So you would be called in to do those kind of flight. How come there isn't a advanced care carrier that handles those calls so that you leave the staff in place?
Well, as I mentioned, back in 2006, Orange made the decision. They 2 years later, we found out they said it was, for reasons that I totally disagree, but essentially interfacility transfers, advanced care, with the exception of to remote northern communities, would no longer happen. So that put the onus on the hospitals to supply the level of care. There are advanced care carriers out there, okay, but the amount of advanced care flying is quite lean, and it is nothing like it was, before.
Okay, because the hospitals are better equipped to do the advanced care themselves?
I would suggest to you, no. There's nothing worse than taking a nurse off the floor of a hospital where she's used to working in that environment. She's not used to getting in the back of an airplane that might be in turbulence and the noise of the engines running and so on. No, she's out of her realm, so to speak. So the program was going along very well, the advanced care program, up until it got chopped, pared back in 2006.
If you look at what we have now, how could patients be better served?
I think that they should, I thought Chris Mazza was on the right road there for a while. And I believe I said that, is when they cut out the advanced care, the interfacility transfer, well, why did they do that? Money. Funding. Advanced care paramedics make a lot of money. I'm told these days, and I don't have any working for me, but I do talk to the other operators on occasion, and most, if not all, of their paramedics also work for ORNGE. They're advanced care paramedics. And on a part-time basis, they're commanding between $750 and $1,000 a day. So very, very expensive. I don't know what ORNGE pays them, but wow. So that said and done, build it and they will come again. If they went back to opening up the advanced care interfacility transfers, that really what needs to happen. From my perspective, the reason what happened in 2006, it was a money grab. He was running out of funding, he being Dr. Mazza, ORNGE. And so that's one way to par back. All he did was, okay, ORNGE isn't going to pay the carrier to supply advanced care coverage because the paramedics are, quite expensive. We'll just send a primary care airplane and put the onus on the hospital to send the nurse. And so that's what happened.
So coming back to my question, given what we have now, what would need to change for the people of Northern Ontario to be better served?
I think a couple of things. Let the air carriers operate the aircraft and let ORNGE focus on its original mandate. Their original mandate was a full mandate. You're pretty busy doing everything that they were tasked with. Okay, aviation by itself is another large chunk that needs to be done by people who know really what they're doing. And ORNGE is, hey, we'll go out and we'll hire some people from the private industry and bring them in here. Well, they're leaving one at a time, but they're leaving because they can't work from what I can see, within the bureaucracy of ORNGE. So if they brought back, the other problem is training advanced care medics. It takes a long time to train them. And right now, the Academy of Transport Medicine, which is operated by ORNGE, one of their mandates was to train medics. If I call them up and say, I want to put some advanced care medics on course to train them up, no, we're only training ORNGE medics. Oh, okay, they won't train any for me. So. And
this has happened recently? No, because you don't have them anymore.
Well, I'm not advanced care anymore, but we've been basically told that they can't. They're having trouble keeping up supplying their own. So so there's a big shortage of advanced care flight paramedics. It takes a lot. They're trained, and then it's continual education for them to maintain their certification. So that needs to get spooled up. They need to increase the amount of people that they can have as graduates in order to facilitate that. There was one mention, and I actually forget who mentioned it to me, but it was from ORNGE though, and he mentioned that they were thinking about maybe perhaps having a community college teach the advanced care program, which makes sense, of course, because that's who teaches the primary. ORNGE, of course, does the aerophysiology part of it, but the only thing that went in the back of my mind, because I didn't comment to the gentleman, but I said to myself, well, wasn't your mandate to train medics? Now you're saying you can't do it, and we'll just slide that over there, but we'll fly airplanes? I'm being facetious here, but that's, okay, your mandate was to train these medics, the advanced and the critical care medics.
So to make things better for the patients of Northern Ontario, so do you support or don't you support that trainings be done outside of ORNGE? What would be better for the people of Northern Ontario? for the people who need the services? I should include all of the province because there are people
Sure.
everywhere in Ontario that relies on air ambulance.
Personally, I don't care where they're trained as long as they get trained and there's a mandate to get them trained. It's not something that's going to get put together just overnight. It was in Orange's mandate, and I would suggest to you that Orange does have the people there with the expertise to do this training, but they do need to ramp it up.
So if we were to do those two things, if we were to ramp up training, either through community college or through Orange, and if Orange was to divest itself of its air carrier mandate, things would be better for the people of Ontario?
Absolutely.
Okay, so walk me through this. The taxpayers of Ontario have already bought airplanes and helicopters. We already own that equipment. How does a garage sale help the people of Ontario?
Well, I think that the financial arrangements with the aircraft and the helicopters, I'm not completely privy to, but I understand, contrary to what was said earlier, is that what you're telling me is that the Ontario taxpayer is on the hook for those aircraft, and if that's the case, then it could be done in a couple different ways. The aircraft could be, the operation of the aircraft could be tendered out or through an RFP process in various manner, more than perhaps one operator to operate the aircraft. Alternatively, they could sell the aircraft, and there may be operators out there willing to purchase them or just on the market. I will tell you that Thunder Airlines, I offered to buy the aircraft from Orange once already.
Is there fixed wing?
Yes.
All of them?
Yeah, well, if it was tied to contracts, yes.
And walk me through, how does that help the people of Ontario?
You have 4 minutes left.
Okay. Well, I think we can provide the service, first of all, for a lot less money than what it's being costing at the moment.
How do you know that?
How do I know that? Well, when I look at the number of people working in the aviation group in Orange and for the number of aircraft that they operate, and I operate more aircraft than they do with half the people, that kind of tells me something. They just, and they can't make anything happen there quickly. I have more airplanes than Orange does. I'm not counting the helicopters.
And when you open up, you made it clear that your business is not solely air ambulance. You also do charter, you also do mail carrier, you also do scheduled flight. I see a huge difference in this. You always have to have oversupply when you're in the emergency business. It would be like saying, well, we're only going to staff the fire hall 6 hours a day because they are only on call 6 hours a day. No, you staff them 24 hours because you don't know when those 6 hours. So I really want you to walk me through, where are the savings?
Well, the savings is, though, that we've already got the infrastructure in place. We're operating, we have a mature...
So does Orange. Orange has invested into that infrastructure. You and I and our taxes have paid for that infrastructure. It is there now. If that was 2006, I would agree with you, but I want you to convince me you haven't done that.
Mm-hmm. Going forward, the cost of continuing to operate Orange versus what your return that you're getting, just with the number of employees, with the, as you mentioned, some of the infrastructure, the hangars that they've purchased outright, the aircraft and so on. Is the government going to get their money back just immediately in a blink of an eye? No, but over time it will. As I mentioned, the money grab back in 2006 when they cut out advanced care flying, okay, that was a major decrease in service to the people of Ontario. But I would suggest to you that they didn't cut the budget at the same time. Where did that money go?
Well, we have a pretty good idea where it went, and there's a nice boat sitting someplace that explained part of it.
I honestly believe over time, the Ontario taxpayer will be better off divesting the air carrier portion of it.
Mr. Mackie, you see, though, how you haven't made that case out objectively. You're just kind of speculating, saying it's your opinion, but we need to know concrete ways that it's actually going to be better. But I guess our time's up, so get that.
You're pretty much out of time, Mr. Singh, so we'll move to the government. Mr. Morrow.
Thank you, Mr. Chair. Mr. Mackie, good morning.
Good morning.
Thank you for being here. I very much appreciated your presentation for a couple of reasons. One, it's insightful and very helpful. But two, I'll just make a bit of a statement before I ask you a handful of questions. And that being, you know, your opening remark was that when Orange was first rolled out, that you saw it as a, at first blush, a positive development in terms of the provision of air ambulance in Ontario. And my point is simply this, and when I was first here in 2003 and was on public accounts back then, and the auditor's report came in, of course, we were auditing the work that was done under the previous government. And I remember all of us, you know, it was almost a bit fun because, of course, you were being critical of the work of the previous group. And, of course, now we are here as the government, and the auditor does his work, and we are seen to be connected to whatever errors there may have been if people see errors. And that's fine, and I have no problem with that. That's as it should be. My point is this, that as a government member, and I would expect that my colleagues in the opposition would probably agree with this, given the opportunity to discuss it, that all of us, especially those of us who've been elected into government, have a major issue and challenge related to all agencies that operate in the province of Ontario, not just Orange. And there are some 600 plus of them. And my reason for saying that to you is that the public makes no distinction between the Ministry of Health and Orange as an agency. When something goes wrong in an agency, they will look to the government and they'll say, what in heaven's name have you been doing? They don't make the distinction that government is not operating on a daily basis and running it directly as they would with a line ministry. And so I find this discussion really helpful, and I'm glad that you're here, and I'm glad that Orange is before the Public Accounts Committee, because it speaks to a broader issue that I think as a government, ours now, governments before, and governments to come, need to pay closer attention to in terms of the operation of all of our agencies, because it creates a great challenge for many of us. So I just wanted to make that statement to begin with, and the fact that you saw them initially potentially as being something positive. First question I'd like to ask you was about this conflict with the dispatch piece. I believe you said, if I'm wrong, please correct me, that this issue with conflicts when it came to dispatch existed before Orange. I would assume that there was some... Well, first of all, why don't I just ask you, yay or nay if you can. Is it new that there are conflicts now with dispatch? Was it something that existed previously? Or
it existed previously as well on various occasions.
Okay. So,
I'll just be very quick.
Okay.
I have an aircraft. The registration is RWK. This is final letters. RWK stands for Rose Weiler Keller. Okay. Rose was a dispatcher for the Ministry of Health.
Yeah.
Mr. Keller was an aviation air carrier owner.
Yeah. And so I'm not trying to diminish this, and it's an incredibly serious issue that you raise. I'm only trying to state that this is something that needs to be fixed as best we can, but it's not always necessarily an easy thing to do. My point would be this, that I take very seriously the role that you play. You're a serious company with 100 employees, and you do great work. At the end of the day, and I don't want to get into the discussion of the details of an algorithm, but at the end of the day, you're concerned with your bottom line, as you should be, and I have no problem with that. As a group sitting around the table here, we need to be concerned that we're not negatively impacting you in that regard, but we also need to be very concerned about what that potential conflict of interest may mean to the service level. And if somebody can sit there and say that through this conflict, an airplane was dispatched, a fixed wing or a helicopter, and it took that aircraft 5 minutes longer to get to a patient, then this is very, very serious. And I suppose my question to you would be that. Because your comments were in the context of what it meant to you as a business owner. I have no problem with that at all. But I'm asking you if you're able to say to me here that that potential dispatch conflict has led to reduced service levels for patients not just in Northern Ontario, but of course that's an area of great interest to me, but in Ontario anywhere.
No.
Okay.
In this particular instance,
okay.
No, I cannot speak to that. This individual is actually what we call a long-term planner,
okay,
who plans the next day's flights.
That's important for me. I hope you appreciate why that's important for me to get that on the record. Because at the end of the day, if somebody's going to leave this committee and walk into the legislature and talk about a conflict in dispatch and service levels and people are dying waiting for an aircraft or whatever the language might be, it's very, very serious. And it was important for me to get that distinction from you. Thank you for your answer. You also mentioned that you had called Mr. McCallum on this and that he has indicated he's looking into it or getting back to you. That you have not received a final response yet in that regard?
No, this just happened a couple of days ago.
Good. Okay. Fair to say. In terms of your bidding process, when you, through tender RFI or RFP, you must have to be able to demonstrate some capacity in terms of your ability to respond in a time constraint, just like a fire department when the bell goes off. Fair to say?
Yes, the time requirements are in the RFP.
It would have to be a key component, I would expect, not just the money side of things. Okay. So has there been ever examples where dispatch that we know of has made a call to a provider through an SA that we could look to and say, how in goodness names could you have made that call, assuming there are no other variables for the call to have gone somewhere else, when you know through the provision in the SA that I'm the guy, that Thunder Airlines could have been there before Air Bravo or whoever the other three providers are?
No, I would not be privy to that information.
Okay. I wanted to ask you a little bit about the audits because that issue was raised. How were your audits done before ORNGE came into existence?
We'd be audited by the Ministry of Health, and we still are audited by the Ministry of Health, just not ORNGE. As a matter of fact, when they audit us, and I know it's been already stated in here, when the Ministry of Health comes in, when we have to renew our license, it's usually the only time we'd ever see them. But that was a very extensive audit. When they first started auditing us as an licensed air ambulance service, there was a learning curve because they were used to auditing land ambulance services, but they've come a long way. It's probably one of the most thorough audits that we ever go through. And just as a side note, as a matter of fact, for the first time since I've been in the business, just on the 28th of August, Ministry of Health walked in and did an unannounced audit.
Okay.
Okay, it was a quick, unannounced audit, and she caught me at a bad time, but regardless.
Was the audit financial, operations, everything?
She had a check sheet. It was basically a spot check. They weren't going through documentation. They were going through the basics. Was the ambulance clean inside? Was it stocked? Was the crew available?
So to get to, I appreciate that. So there were questions around the third-party audit process that's going on now, and that was interesting. I will say more questions than answers I still have on that piece, but that's fine. But as you've just indicated, there is still Ministry of Health audits as well.
Well, they audit us every 3 years for the ambulance license, and I mentioned we had this walk-in audit the other day, which was a first for me.
So the certification piece is, there's also a certification piece, correct? Every
Yes.
3 years you're certified?
Every 3 years, yes.
Okay. Can you tell me, as an operation, you've been in business for a very long time, and the previous question spoke a little bit to where I wanted to go with you as a private operator. Pre-Ornge, under Ornge, and post with the new administration of Ornge, what percentage of your overall business would have been related to air ambulance work? Is it higher, lower? It's about the same? Is it?
No, we're doing about half of what we used to.
Half of what you used to be. So as a percentage of your total work, I mean, if you made $100 a day before and $5 of that used to be air ambulance related, today it's $250?
Today it's about 35% of our business. Okay.
Air ambulance today is 35%?
35% of our business.
And
it used to be closer to 65.
Okay. So it was always a very significant piece of your work?
It was a very significant
Okay.
piece of a lot of air carriers business, and that's
Yep.
one of the things we were trying to raise the flag for
Yep.
a number of years. Is
Yep.
just that, you know, in air carriers, some air carriers couldn't survive
They couldn't make
and
the-
diverse themselves.
Right. Okay. That's good to know. Thank you. When you tender now through Ornge, is there in your tender for you, there must be some guaranteed component. I haven't had a chance to read this document that's here before us today, that was on the table when we walked in this morning, but I don't know how many pages this is, but it's over 100. But is there, as a private carrier contracted through Ornge for the provision of air ambulance, are you guaranteed a minimum number of hours or a minimum dollar value on an annual basis, just so you're there and available when required?
We are now, yes.
Okay.
Yeah.
Is that new?
It's relatively new, depending how long you've been around. For me, it's relatively new. It was this contract and the last contract they had that.
Okay.
A minimum guarantee, but that minimum guaranteed was a negotiated number.
Okay. So this contract and the previous contract. So the previous contract would have taken us back to what year?
It was
3-year how long?
Yeah, it was 3 years. It got extended 1 year due to the kerfluffle about a year and a half ago.
Okay.
So it ended up being 4 years.
Back.
Yeah.
So
it was
somewhere
09,
around,
I think. If memory serves,
Okay.
I think the last one was 09.
So somewhere around 09, it became part of your contract that you have some guarantee. And to me, it makes perfect sense, obviously. I don't think that you could probably be involved in this business any other way. I mean, if you've got people on standby, obviously you've got an expense you need to cover.
In fact, I mean, that's not to say that there are provisions in this RFP for people to have aircraft available with no guarantees. Okay, and in fact, that used to be the norm under the Ministry of Health and Ornge up until, let's say, 09. But the number of hours of guarantee would be something that would be negotiated.
It would be based on historical service volumes, or?
I think you'd find it was pricing.
Okay.
But
so did you say some carriers still today have zero guarantee?
I cannot say that. The provision is there that it's possible. We don't tell each other how much
but for
business
you,
we have.
Okay, well, we can just then contain it to you and Thunder Airlines.
Yeah.
So for 4 years, you've had a guaranteed
Yes.
revenue stream, and to me that makes complete sense, and it's understandable.
Yeah, the first contract in 09, I mean, we got, how shall we say, lost the bid. We were not the lowest price carrier, so in fact we ended up closing bases. Sudbury, we had a fixed wing in Sudbury, one in Timmins, and we shut down one in...
But the combination of the work that you do, I think there's 5 private carriers contracted.
There is now, I believe, yes.
Okay. And again, maybe a question you're not able to answer, but the totality of what's available, and I take your point about what's happened historically through Ornge, but your aircraft, the other 4 private carriers, fixed and/or ambulance, along with what Ornge has in its fleet, do we know if there are now more or fewer aircraft available to service the population than there was previous to the creation of Ornge?
It's difficult to say for certain, but I would tend to say that there are fewer.
Oh.
There's definitely fewer operators, and there's definitely fewer SOA bases.
As a private contractor, I mean, there was a question previously about fewer bases, and that's a serious issue. I don't know that it necessarily means reduced service. I don't know that. You're the professional. You might be able to speak to it better. I mean, I think of the example back in the city of Thunder Bay right now. They're just reworking where their fire bases, the fire halls are located. I don't know if they're ending up with one reduced base, but they feel like with the geographic distribution of the newer bases that they're building, the response times will actually go down for the fire trucks leaving the hall. So my question to you is that. I mean, if in fact, I think you said, and I think a previous question from Ms. Jelena asked that, I believe, there are fewer bases. Does it necessarily mean, I mean, are the response times slower than they used to be?
Well, they're basically going to be. Just to put it into perspective, you have fewer bases. You no longer have an aircraft in Hearst anymore. You don't have one in Fort Francis. You don't have one in London, Kingston. I could go on.
Yeah.
There's a lot of places you don't have aircraft anymore. Those aircraft, which were pre the last guarantee thing,
okay,
were not costing the government a dime.
Okay.
They were there. People made them available.
You're talking private carriers?
Private carriers.
Okay,
they made
so
them
you're
available. They
okay.
still had to meet ministry requirement. They were licensed ambulance services.
Okay.
Okay. And under Orange, this ended up closing up shop. They couldn't make it go. So now, what you have is there's a patient in London that needs to get moved, or a team out of London, or someone out of Kingston that needs to get moved. Instead of the airplane being there ready to go,
yeah,
you got to fly one in.
Yeah.
It's going to take more time. It's definitely going to cost you more money.
Right. The piece that you chatted a bit about was this advanced care piece. So you focus now on the primary care part. And with paramedics, it's my understanding there's primary, advanced, there's also critical care paramedics. Is that?
That's right.
I just met a young man in Thunder Bay from Sault Ste. Marie last week who was explaining this to me, looking for a job right now, actually, a young guy from Sault. Girlfriend is going to education school in Thunder Bay. But in any event, he is a primary care paramedic, and he was explaining to me that to be critical care, and we haven't had any discussion about that, and maybe it does not fit into the air ambulance system, I don't know, but I think it does. I think there are critical paramedics on air ambulance, but we haven't heard any discussion about that. But he said is it an extra 3 years of training beyond the advanced care level?
I can't speak to the 3 years. I don't know, but it's definitely
seriously more.
It's serious, and the critical care paramedics in the system are excellent.
So from the advanced,
they do a lot.
So from the advanced care piece, how much time do I have for that?
3 minutes.
From the advanced, do you have a question? From the advanced care piece that we were talking about, and there was an example I think that you raised about a Big Trout Lake example.
Mm-hmm.
You did say that there is a base in Sioux Lookout.
Yes.
And you did talk about the money part, that from Orange's perspective, this would have been seen as a cost saving for Orange not to have on the bird that's flying up that particularly trained paramedic, because they were going to get the support on the end when they got the patient, if I'm understanding this correctly. And then it would have been a nurse and or some other health professional who came back with the patient that you went to pick up.
Well, just to be clear, that would be like if they were sending out a primary care aircraft, such as ourselves,
right?
Excuse me, which used to be, could have been advanced care. Instead, we would go and pick up, say, depart Thunder Bay, pick up in, Terrace Bay, Armstrong, Marathon, Geraldton, wherever, and to bring them back. Then it would be up to the hospital,
right,
to make sure that they sent a nurse, doctor, or whatever.
I guess what I'm trying to get at with this question is the care level, again, for the patient who's being picked up. So from your perspective, you were not traveling the first leg of the journey with the advanced care paramedic on your plane. You would know what's required, the patient's needs are, but the hospital was then responsible to staff appropriately on the flight back to the hospital what those patients need. So I guess I was just a little worried that maybe the impression was being left that from a care perspective again, that the patient was not being appropriately cared for. It was almost a bit of a transfer of financial responsibility, if it's fair to say that I'm interested in your comment on it.
It was.
Okay.
Now I'll take the business hat off and I'll go on to, it might be Bob one day who's the patient hat.
Yeah.
And what it boils down to, and I knew Chris Mazuk fairly well actually, and his focus up until 06 was he did not want those nurses. It was about patient care.
Okay.
And that is why he was such a proponent of the advanced care, interfacility advanced care. He didn't want, and probably somewhere I've got the memos even from his office saying they want to do all of these transfers. They wanted these advanced care people. They wanted to increase the level of care in the back of the air ambulances. Okay, to that point. And then all of a sudden one day it just, like I said, stopped.
So the person on the other end who's traveling back with the patient, and the example, the healthcare profession example that you were using in response to the question from Ms. Jelena, was that you were saying a nurse. Now, I don't know if that's just you being colloquial and saying if it's always a nurse, sometimes it's a nurse, or if it's a different professional. I don't know.
They send who they require to deliver the amount of patient care required. You know, sometimes.
So that's kind of my.
I've had two doctors in the back.
That's kind of my point.
Yeah.
So again, to the service level, whether Mr. Mazza was interested in an advanced care inter-facility transfer or not, that's fine. At the end of the day, the question still remains for all of us. Given that that's not work that you do anymore, the patient on the other end who's coming back in your aircraft has the appropriate healthcare professional with them when they're coming back.
They have a level of care, and I will agree with Dr. Chris Mazza on this one. The level of care that most of them are getting with a nurse who's been brought in off the floor versus having a trained advanced care paramedic in the back of the airplane is not the same.
So an advanced care paramedic.
Yeah, there's actually two paramedics on board on those flights. There's a primary and advanced care. The primary assists the advanced care, and the level of what they can do for a patient is very high.
So if you could leave this committee with a recommendation, this might be one thing that we can take away from this. You believe that might be a gap in service. Mm-hmm. Now, but you also said in your previous comment to the same question that sometimes there are doctors on the plane with patients that are coming back, that it's not always a nurse. So the fact that there's not always an advanced care paramedic on the aircraft doesn't mean that the patient's not necessarily receiving the level of care they need for the return flight.
No, the advanced care can handle a bulk of the serious cases, but of course that's why you've also got critical care paramedics, right?
No, my question was on the...
And to be honest with you, and just from my experience is some of these transfers, especially if I was an acute patient, I'd rather have the critical care paramedic with me than the doctor, with all due respect.
Okay, and we're a little bit over time, so we have a couple minutes left. Mr. Cleese?
Chair, how is that the case? If we all had 20 minutes, how is it?
Still more. You've had 23 now.
So I'm asking you...
I'll come back to you. If you just stop talking, we'll get around to get another...
Well, I thought we each had 20 and then
Thank
we were
you,
done.
Chair. Mr. Mackie, on the issue of the technical requirements within the contracts, I understand that all aircraft under these contracts are required to have a traffic collision avoidance system installed.
That's right.
And what is the cost to have that installed?
That varies a little bit depending upon what you've already got in the airplane. It's one thing to buy a little black box and put it in the remote. You also have to install antennas, but it's also how you display it in the cockpit to the crew. So it can be, to install it, it would vary, but $50,000 to $70,000 or more.
To your knowledge, do all carriers comply, or have all carriers complied with that contractual requirement?
Today, I can't speak to that. Previously, I had a concern because I don't believe that was the case.
Has Orange monitored and inspected the aircraft to ensure compliance?
I think we've already said here today that they don't, but to my knowledge, my answer would be if they looked at it, they didn't know what they were looking for.
And what is the implication to the carriers? If one has complied and the cost is $70,000 to install that, another carrier has not complied, obviously, there are some very serious implications to your ability to carry on.
Well, there's going to be, it boils down to, you asked me where you might want to cut back on things. Well, I suppose that's one, if you're not being in compliance with the contract. You can save 70 grand times a few airplanes. That adds up pretty quick.
One last question, if I might.
Sorry, that's it. Ms. Yelenis, do you have another question?
I'm good, thank you.
Mr. Morrow, back to you. You're fine, okay? Please go ahead now.
One last question.
Sure.
A satellite telephone.
Yes.
How important is that to the operation of an air ambulance?
It's extremely important. Our medics are actually, at times and as need be, are literally on the phone, in the air, talking to the doctor at Orange and receiving direction as needed.
If that air satellite telephone is not functional in an aircraft, what is the implication?
It would have it could be extremely serious given what the situation was at the time. We don't use it that often, but when you need it, you sure need it. Just again, depending upon the patient.
If it's a critical patient,
you need it.
You need it, and yes. If you have a critical patient that you're about to transport and you don't have a functional satellite telephone, what happens? Do you lift off?
You're not supposed to.
Thank you.
That would be a call made by the medic at the time.
Thank you.
Thank you very much. Coming back a second time to the committee. Appreciate it. And we're recessed until 12:30.